emergent surgery and outpatient appointments. So how stretched is the service right now? Well, joining me is Dame Donna Kinnair, the Chief Executive of the Royal College of Nursing. Good to see you on Sky News. Thanks very much for being with us. Just paint a picture, if you would, speaking to your colleagues as you do on a regular basis. What are they telling you?
So nurses are under extreme pressure at this moment in time. If you think about it, they've been working since the start of the pandemic and it's not getting any easier. They're now coupled with winter pressures and an NHS that wants to keep the service going for those suffering from cancer or other ailments. And so we've almost got a perfect storm now where actually we entered the pandemic with not enough staff. We were 40,000 under in England. And, you know, they have had to keep working, they're cancelling shifts, and also nurses themselves are falling a victim to this vicious virus and are therefore having to isolate or take time off work. So actually we're in a state now where the best thing that the public can do is observe the rules and stay at home.
How is the testing regime and vaccinations going amongst nurses?
Well, I think that one of the things that the joint vaccination group said was that we needed to start with some of the older people, and then nurses and other frontline workers are very high on the priority list. And we know that they're getting access to them, but actually, you know, with the second vaccine now out, we know that that the staff in terms of healthcare and have to be considered a priority, not just staff in hospital, but staff in community that are actually delivering services or care to older people in the community. So actually it's a real priority now to get members of the health and care community vaccinated so that they can continue to do their work without having to take time off to self-isolate.
Do you feel that that isn't a priority then at the moment?
Well, it is a priority, but we know that the priority is hindered by the number of vaccines that are available. So I'm being very optimistic at this moment in time because as the second vaccine comes out, we know that one of the things that we're calling for, as in other colleges, is that actually health and care staff have to be a priority so that they can continue to do the work that is so vital. And don't forget also that they are the same staff that will be giving the vaccine out. So actually we need them there. We need them to be available to provide the care that they can do if they're well enough to do so.
Give a sense of just how difficult conditions are for nurses in hospital right now. We've heard some pretty difficult stories about people having to be treated in the back of ambulances, about a shortage of beds in ICU.
Yes, and I spoke to some of my colleagues yesterday morning, and what they're saying to me is that actually it's unprecedented and very overwhelming, the number of patients that it needs to care for. Don't forget, we're at a higher level than we were at the start of this pandemic. And if you think about it, all services were in lockdown then, so we weren't providing outpatients, we weren't doing so many of those other things, and now we're trying to do it all. So consequently, those staff are absolutely exhausted, and it's gone on for such a long time.
But we're also, sorry to interrupt, we're also hearing, aren't we, that hospital admissions are no higher at the moment than they were this time last year and the year before.
But admissions don't translate into the work that nurses have to do, because you might not get admitted, but if you turn up to accident and emergency, there's still some care to be delivered to you by a finite number of staff. So actually, if we've got ambulances queuing, they may not all translate into admissions, but they all translate into frontline staff having to deliver some type of care, whether it's just hydrating those patients, whether it's giving them drugs, and then sending them home. All of that is work that frontline nurses and doctors and others have to do.
And of course we know that many nursing jobs remain unfilled, so they're having to work even harder.
Well, if you put the vacancies that exist alongside the fact that we have a number of them themselves fallen victim to this virus, you can see that other people are having to work twice as hard to deliver the care to the front line.
When it comes to recruitment of nurses, how is the pandemic going to change that? Are you finding more people are coming forward because they want to help and they want to be involved in the profession, or is the opposite happening, that nurses are finding it so difficult and so stressful that actually they want to leave?
So it's no doubt that the pandemic has made the nursing career very attractive because people have sat and witnessed the complex skills that nurses have required to help people fight through this pandemic. However, on the other side, we've got a number of nurses who are extremely tired, extremely frustrated. You know, if you think about some of the things that they've been through, watching their colleagues die, as well as trying to provide this care on an ongoing basis, it's draining. And so what I'm hoping is that actually, if we can allow some respite for the nurses that are currently practicing, so that they can regain that love of their career, as well as be attractive to those new ones that want to come on board, that we should keep our profession well staffed. And so I call on the government to make sure that they're, valuing nurses, whether that's through paying them well, that looking after them, and making sure that we keep this career as attractive as it can be.
Of course, and just finally, and you've said this once already, but just reiterate it, I think it's worth it, your message to the public on New Year's Eve.
So observe the rules, keep washing your hands, keep observing social distancing, stay within your bubbles or in your homes. Please don't go out. We're not yet at the Australia level where we can celebrate New Year like they've done. So actually, please observe the rules and look after yourself and stay safe.
Dame Donna Kinnair, Chief Executive of the Royal College of Nursing, thank you very much, and a Happy New Year to you.
Thank you.